So I want to talk about some of the ways doctors go about diagnosing FAP, which I think is pretty important considering that receiving an FAP diagnosis is so time sensitive just because it's really vital to get diagnosed before colon cancer starts forming. And I don't even really know how to describe diagnosing FAP because on one hand I feel like it's probably really easy to diagnose FAP just because FAP has so many distinctive characteristics, but on the other hand, I feel like there are so many people who go undiagnosed until cancer starts forming because these procedures used to see all of these distinctive features of FAP aren't part of a regular checkup. And people with FAP, for the most part, feel pretty healthy for the first several years of their life, and they don't think that they need to go to a doctor and get all these other tests performed. And I really think it's almost completely a matter of chance that a person without a family history of FAP gets diagnosed before it's too late and cancer starts forming, which it's crazy. But anyway, I just wanted to talk about some of the tools that doctors use to diagnose FAP. The main one, I think, is a colonoscopy, which is where doctors take a scope, which has a camera at the end, and they stick it through your anus, up through your rectum, and then into your large intestine. And you are completely sedated throughout all of this, so you're not feeling any of it. But the night before, you do have to do some pretty unfortunate prep work, which involves drinking a lot of laxative, so you can clean yourself out and the doctors can get a good view of what's going on in your intestine. And that part is not so fun, but the actual procedure is pretty painless. But yeah, usually once the doctors get into your large intestine, I think it becomes pretty obvious that you have FAP, because you'll have generally hundreds of polyps lining your large intestine, which again is pretty uncommon for anyone regardless of their age and is pretty characteristic of FAP. But just to be sure, the doctors will probably take samples of the polyps and send them off to a lab to determine the pathology of the polyps, which would help confirm an FAP diagnosis. So, I sort of feel that giving people who are in their late teens a colonoscopy would pretty easily determine whether or not they have FAP, hopefully before they develop cancer. But the thing is, colonoscopies usually aren't given to people until they're 50, unless they have a history of colon cancer in their family, and by that time that's usually too late for a person with FAP. So, yeah. But anyway, if you had a colonoscopy and they saw all of these polyps, you'd probably be then recommended to go and get a genetic test done, which involves just drawing some blood, and they'd send it off to a lab, which would screen for some genetic mutations, and if that came back positive, that would confirm an FAP diagnosis. However, as I mentioned in an earlier video, there are some people who don't have an APC or an MYH mutation who still do have FAP. So if the genetic testing came back negative, that wouldn't necessarily mean that you didn't have FAP. And if there was a known family history of FAP, the parents would know that eventually they'd have to have their children undergo this genetic testing to confirm whether or not they have FAP. And then there is another way I think that's come about to diagnose FAP, and that involves congenital hypertrophy or hyperplasia of the retinal pigment epithelium, abbreviated CHRPE, and I will not be saying that full name again, but I will reference these later on when I talk about some other aspects of having FAP. And these things basically are lesions that form in your eyes that are sort of shaped like bear claws, and having multiple of these is usually a pretty big sign of FAP. And from my understanding, you don't really have to worry about them too much, and they're really mainly just used as a diagnostic tool. And they can be detected on an eye exam by an ophthalmologist. So yeah, but I don't think everyone with FAP has these lesions, so just because you don't have them, that also doesn't mean that you don't have FAP. So yeah, and upon seeing these, the ophthalmologist would probably recommend that you would get genetic screening to confirm a diagnosis. So yeah, so those are sort of the big diagnostic tools that are used to suspect and then later confirm an FAP diagnosis. And if you guys are interested, I'd be happy to make a video detailing more about how I was diagnosed with FAP, since I didn't have a family history of it. So let me know if that might be something you'd like to see, and I'll get on that. Or if you guys would like to share how you were diagnosed, or if there's something that I missed in this video, again, comment or message me. And yeah, as always, any tips or suggestions or questions, comment below or message me. Alright, enjoy.